So welcome everyone to our June Teach Educational Rounds. Here with us today, we have Stephanie Kersta, who will be presenting on the effects of nicotine and cessation on sleep. And this is our first time doing a webinar focused solely on sleep, so we're really excited about it. I'm just going to get started with KMH's land acknowledgement. So KMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of KMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich the city. KMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. Now, I invite everyone to introduce themselves in the chat and let us know which traditional territory you are joining us from today. If you're not sure, you can visit that website there. I'll put the link in the chat in a moment. There we go. And you're also welcome to let us know in the chat something that you are doing to learn or improve your commitment to reconciliation. I'll give everyone a few moments to do so. In the meantime, I'll share a bit about myself and my positionality for those who see my face for the first time. My name is Natalie, and like KMH, I am currently located on the lands of the Mississaugas of the Credit. I am of Italian descent. I've lived in the city for almost 3 years now and continue to be grateful to live, work, and play on these lands and listen and uplift the stories and voices of various Indigenous communities. So thank you. I'll give everyone a few moments to share in the chat. All right, perhaps we'll keep going with some housekeeping items, but please do share in the chat. We love to see your thoughtful comments. So just an FYI for those that might have missed it on the Teach listserv, Teach is excited to be offering again our 2-day in-person foundational health educator workshop in September, which is a requirement for those interested in receiving the certified tobacco or respiratory educator credential. However, the opportunity is open to everyone, so feel free to take a look. More information can be found on our Moodle page, or feel free to email us at teach@kmh.ca with any questions. And as usual, for those interested in receiving a letter of completion for this Teach Educational Rounds, please make sure you had registered for the webinar and completed the pre-learning assessment. As well, make sure you signed into the webinar using your full first name and last name so we can track participation. And last but not least, please make sure to complete the evaluation and post-learning assessment that will be emailed to you by tomorrow, and you'll have 1 week to complete that. Along with that, you'll also receive the slides, the recording, as well as some other resources. So take a look out for that. And here's a little bit more information on our presenter today. So Stephanie Kersta holds a Master's of Science in Psychology, as well as holds a number of certifications, including a postgraduate certificate in addictions and mental health counseling, advanced training in solution-focused therapy, CBT, for insomnia, and psychometric assessments. As a complement to her strong clinical education, Stephanie has incorporated additional evidence-based holistic certificates to further round out her training, including certifications in different mindfulness and meditation clinical modalities. She also holds different teaching positions at multiple post-secondary institutions and has a clinical psychotherapy practice where she primarily treats anxiety, depression, and self-esteem and insomnia. So welcome, Stephanie.
Awesome. Thank you so much, Natalie.
Yeah. And just a note about some disclosures for today. So just want to let everyone know that all eligible Teach Educational Rounds presenters are offered an honorarium, but presentation content is not affected by acceptance of this honorarium. So just a note about that. As well, please know that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. Nonetheless, these materials, as well as the verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. So with that, I will hand it off to our presenter. Thank you, everyone, and enjoy the webinar.
Thank you so much. Make sure I can cover my slides. Welcome. Thank you, everyone. Thank you, Natalie, for the introduction. And then I just also, similar to CAMH, wanted to share my own acknowledgement as a visitor on this land. And I'm coming from Italian and Ukrainian background. I strive to deepen my own understanding of the local Indigenous communities, and I commit to reframing my responsibilities to land and community. I come with respect for the land that I'm on today and for the people who have and do reside here. So today what we're going to be talking about is everything having to do with sleep. And so what I will be sharing, so I'm a sleep therapist. I'm a sleep specialist. I did my certification in CBT, so cognitive behavioral therapy for insomnia. And the way that I like to describe it is literally just how people sleep train their babies. We can learn how to sleep train humans and adults. And so as adults, when someone is struggling with a lot of insomnia, there are different ways, there are different treatments. There's many, many different treatments for insomnia. And one of them that we can do is behavioral based, which is the CBT for insomnia piece. There's also a lot of things that go into sleep before we even start to do some of that sleep training or some of that CBTI sleep training. So what I'm going to be talking about today is some of the different sleep hygiene principles that are really helpful, the benefits of improving sleep, just in general on cessation outcomes, overall health. And I'm also going to talk specifically about the impact or the link between smoking and insomnia, the link between cessation, so when someone is starting to quit or cut down, and how that can impact someone's sleep and how that can impact the outcomes. And then I'm going to talk about specific cessation, specific kind of sleep tips, and then just kind of overall sleep tips. Because there's one thing that I know quite well after talking about sleep and doing this sleep work for many, many years, and it's that many of us are not sleeping enough and that the sleep that we are getting is not the best sleep. So I think, this is very helpful for our clients, but I'm sure there are many of us here that are also not sleeping the best. So I'm hoping that you can all take something back for yourself as well. So like I said before, we're going to be talking a little bit about the effects of sleep, how we can improve cessation-related insomnia, a little bit about sleep hygiene, and then different sleep tips in general. I welcome questions. I welcome conversation. So please feel free to pop any questions, any comments in the chat. If there's anything specific that I'm not sure of, I can always share that and I can answer it. I can do some research and I can share it out with the post webinar feedback. I'll send it to Natalie. So if there's any questions at all, I'm happy to answer them. And this is one of my favorite things to talk about. I love talking about sleep. And so keep the questions coming because it's one of my favorite topics. So a little bit about how like the interplay between nicotine and tobacco. So we know that nicotine is a stimulant. So we know that for many people, they'll have they'll smoke or they'll vape, and we know that it can be really invigorating for people. So we do know that it can mask the impact of exhaustion. And then as a result, what tends to happen is if we're consistently putting this stimulant in our system, and masking, not feeling as tired as we are, what generally tends to happen is the first and last thing someone does is have cigarette or, vape. And so we do know that before bed, if we're flooding our body with a stimulant, that is going to impact us. We also know, and you'll see as we go through this, that there's, high rates of like low sleep and sleepless nights. But because we're not seeing that, because we're consistently getting those little hits of the stimulant aspect of the nicotine, people are not really feeling as tired as they are, but we are knowing that that lack of sleep can impact the body as well. So yeah, I said nicotine increases the availability of dopamine and other neurotransmitters. So, adrenaline, noradrenaline, serotonin, and it's a psychostimulant. So lots going on in the body whenever someone is taking a puff of a cigarette or a vape. We do know that so compared to non-smokers, those who smoke or vape are 2.5 times more likely to experience insomnia. So pretty high. It's about 40% overall of smokers have complaints of insomnia. And then we'll also see very short or short sleep duration. And what that means is the amount of time that someone is actually asleep and actually in a deep sleep stage is quite short. Because I won't get too much into it, but we go into different stages of sleep. So we have 1, 2, 3, 4, and REM sleep. It's actually interesting because a lot of people think that REM sleep is that like really deep, good sleep that we need to be having. And yes, REM sleep is a good deep sleep that we need to be having, but the most restorative ones are 3 and 4. And so when we look at the short sleep duration, we spend a certain amount of time in each stage. And if the duration is shorter, then we're getting less and less of that good restorative sleep. That's a typo. It says sleep at night. It should say smoke at night, that third point. So that if people are having to smoke before bed, we are going to see a greater likelihood of the impact on sleep, which is exactly because we know it's a stimulant. So lots going through the body, boosting that blood pressure, boosting that heart rate, and then going to bed. And it's so interesting because we talk so often about the effects of caffeine on sleep, right? So many people will, in the afternoon, they'll switch to decaf, or, after dinner, they'll be like, oh, like, do you want coffee? And they're like, oh, no, decaf, I can't have a coffee before bed. But no one ever really thinks or talks about like the last thing you do before bed is have a cigarette. It's like literally if you're going to be taking a shot of espresso or something. So it's having the same impact of our body, that same stimulating impact on our body, but we don't tend to really give it the same credit that it deserves. We also know that nicotine in general can disrupt one's sleep architecture. And what that means is we all have our own way of what our sleep style looks like, or kind of what our sleep looks like. And so what we know is that when someone does have nicotine in their system, that increases the amount of time before they can fall asleep. It decreases the efficiency of their sleep, which is, again, that really good, deep, restorative sleep that makes us feel, healthy and invigorated and restored, and also shortens the duration overall. And then, interestingly enough, we do know that smoking can increase the severity and the risk of snoring and sleep apnea. So when we think about cigarette smoke or tobacco and nicotine and vaping as well, those chemicals that are present, they irritate the lining of our nose and throat, thus swelling our airways. And so that is a high risk for snoring and sleep apnea. Just quick in the chat, everyone aware of, does anyone not know what sleep apnea is? It's a pretty common sleep disorder. If you don't know, just pop it in the chat, please. We do also know that those who are experiencing secondhand smoke, so if there's smoking in the home and you're having secondhand smoke, you have a higher risk of snoring and sleep apnea as well, even if you're not a smoker yourself. So I find that quite interesting. Yes, Catherine, it is a typo. It should say smoke at night, not sleep at night. Hopefully we're sleeping at night too. So if we look at the effects of cessation on sleep, so we do know that, again, most people who are starting to cut down or quit smoking, we do know that we will see these adverse effects of sleep for the first couple days or weeks, and they can subside. So naturally, we are seeing that people are having this issue with insomnia. So it's about 42% of people who quit smoking will struggle with insomnia, and then about 80% of current smokers experiencing those sleep disturbances. So if someone already has trouble sleeping, when they go to quit smoking, they will have higher rates. So about 80% of them will have higher rates of smoking or higher rates of insomnia. And then people who haven't had any issues, it's about 40%. So really high numbers. We know it's very common that people are going to experience sleep. What we're experiencing is that excessive daytime sleepiness, which makes perfect sense, because if you think about nicotine being a stimulant, if someone is having those consistent hits of a stimulant, they're not going to feel they're not going to feel sleepy. We take that away, they're going to feel sleepy. It's just like if you were going to be giving up coffee, right? So if I give up coffee, and I've made the mistake of doing that before, and I do not recommend. But if you are giving up coffee, I'm going to be feeling more tired because I'm not having that stimulant. You'll also notice too, if you think about your body when you're, detoxing from cigarettes, or, when you're like when you're not smoking anymore, your body's going through that cleansing process, right? Where our body is getting rid of all the stuff that's been in it. And so there is, bodily functions that are happening, which do, if you think about sleep, sleep is really nourishing, it's really restorative. And so for many people, they do find that they do need to sleep more, that they have that increased need for sleep, mainly during the day, kind of feeling foggy and lethargic. So it's kind of a 1-2 punch, because they're not having the stimulating effects anymore, but then also their body just needs more sleep. And then thirdly, many of them aren't really sleeping that well at night. NRT, so nicotine replacement therapy, it can also have stimulating effects. For about 10% of people, they do report insomnia as a side effect that can last the whole time. So for some people, it doesn't affect them, but there's some people who just get it in the short term, and then there are some people who get it quite for the entire time. Why this is important to know, though, is that when people are experiencing cessation-related insomnia, they do have a higher risk of being unable to quit. So it can impact their success rates and their ability to actually continue on with this. So we know that there's been studies in 2017 and 2020, and they both found that the insomnia related with cessation has caused people to resume smoking. And it's very true. Like, if you think about it, sleep is and insomnia is a very terrible thing. If anyone's, ever experienced it or has experienced it, as a one-off, it's really terrible to not be able to sleep at night. And so you're already feeling not great. I'm sure you're already dealing with a lot of like cravings and triggers. And then on top of that, we're not having that restorative sleep. We're feeling really not great. And for many people, knowing that, and knowing if it's, especially too, if it's a new, I just quit smoking, and now I'm experiencing this insomnia. For many people, knowing that all it takes is to go back to a cigarette, that it will make it go away, that can, cause someone to go back to smoke. So it is quite significant. Knowing that it's common, it's important that we bring it up and talk about it when we are counseling people, because it can have a pretty significant impact on one's quit attempt. And again, if there's any questions or comments or thoughts, I'm happy to answer them. So I'm going to be talking a little bit about the different tips to relieve cessation-related insomnia, so specific ones for when someone is actively quitting. And then I'll talk about different sleep hygiene and different tips that we can do just in general that shows to help. So we do know that caffeine in general, so smoking and caffeine tend to go hand in hand, but smokers metabolize caffeine differently. And so when someone has quit smoking or cut down, caffeine, it's being metabolized differently, so it can affect someone a little bit more. So we do find that decreasing caffeine can help, because you're not having as high levels, and your body is, metabolizing it a little bit better. So decreasing caffeine. I also find half and half. So 50% caffeine with 50% like decaf coffee. So if someone is brewing a coffee for themselves, just doing half and half, it doesn't feel as significant for some people. But that is something that is quite common. That can be helpful. Some people also find that removing the patch before bed can be helpful. I've mixed things on this, because I do find that, having the patch on with sleeping has been really effective for a lot of people, especially for that early morning craving. But also for some people, it can have really stimulating effects. So it's looking at that. We know it's like that 10%. So for some people, if it is, quite persistent and they are struggling from it, that is something that can can certainly impact them. That is a conversation to be having, but it is, something that we know if we're just removing that stimulating effect, that certainly can be effective. Something I really like too is adding tryptophan-rich foods into your diet. So I don't know if many people, around Thanksgiving time, people are eating turkey and everyone talks about how after Thanksgiving dinner, everyone feels tired and they all say it's because of the tryptophan. And, it's been debunked sometimes, but not, but, it's always come out. But we do know that tryptophan can make someone feel a little bit, it can help it can help make someone feel more restful. And so having foods that are, more high in tryptophan can be helpful. So animal-based protein sources, milk, cheese, tofu, tempeh, seeds. And something I really like, and I don't know if anyone's ever heard, is I know it was making the rounds quite some time on like TikTok and Instagram. I have a lot of clients who love TikTok and Instagram, so I spend a lot of time, learning what's new and viral. But there was something called like the sleep kind of mocktail that people were making. So it was tart cherry juice mixed with magnesium and then topped up with bubbly water. And so I actually dove into the science behind that for many of my clients, and it has shown to have some evidence behind it. Tart cherry juice is high in tryptophan, so it is a source of tryptophan, which can be sleep inducing. Magnesium, which I will be talking about, can also help. And so for many people, that can be, it's also a cue to ourselves. And I'll talk about this when I talk about sleep hygiene. It's a cue to our brain that it's time to go to sleep. And our brain does really well with cues and reminders. And so that can also be a really good cue for people. Melatonin, I have mixed thoughts on melatonin. So most people, again, melatonin is, and sleep tend to go hand in hand. People say if you have trouble sleeping, they're taking melatonin. For some people, it works really, really well. For some people, not so much. I do see that a lot of people have and can have adverse effects with melatonin. So there are some side effects that people don't love. I personally, with clients, I will oftentimes recommend magnesium over melatonin. And the reason being is because our body produces melatonin when we sleep. And so our body can produce melatonin. And so for me, and what I find to be effective and more long-term, have more long-term efficacy, is I would rather have someone do things or take something that helps get their body into a state that it can produce the melatonin that it needs rather than taking melatonin. Tracy, I agree. Time-release melatonin can be a bit more effective. And then melatonin linked with GABA. I think there's some supplements too. Some people have had good responses with that as well. Melatonin specific for cessation-related insomnia has been shown to improve just kind of the overall irritability and insomnia related with cessation as well. So interestingly, specific to cessation, melatonin has shown to have a couple more impacts and a couple more positive effects. I would say checking with pharmacists is always a good thing with people. I'm going to just read some of these questions because I don't want to lose them. Leslie, I'm not clear why quitting causes insomnia. Why wouldn't it cause rebound sedation? I can understand why NRT causes insomnia. Yeah, so the NRT causes insomnia. It does. It causes the sleepiness, definitely. So you're saying like definitely the rebound foundation. But we do know that because when the body is kind of detoxing, let's say, like removing a lot of the chemicals that are in it, it can, the body's just kind of, we're not in our usual practice. And so that can cause some wakefulness in the night, number one. Number two, when you're messing with someone's, and I'm talking about this when I talk about sleep hygiene, when we mess with someone's routine, that can also prevent someone from being able to fall asleep. So I'll find sometimes a lot of clients who, when we talk about cues for bed, I mentioned that when I was talking about tryptophan foods. When we talk about cues for bed, for many people, that last cigarette before bed is their cue for sleep. And we're removing that, and maybe someone is dealing with some cravings with that as well. That can cause remove those external cues. So it impacts someone's sleep hygiene. Lastly, that jitteriness that someone gets and that kind of like overstimulation that people can sometimes get just from not having the cigarettes anymore can cause that as well. You know what, Marie? I'm not talking about nightmares, but I can certainly send around some information on nightmares as well. And Nina, yeah, definitely, I would say, yeah, removing the patch or cutting it in half can definitely can also be really effective. And again, it's a small amount of people, it's about 10%. But again, if it's lasting, you know, if someone's looking at 10%, if someone's looking at that for 12 weeks, that's really daunting. If someone, you know, can rebound from it in 2 or 3 weeks, I would say, you know, maybe we're adding some other, you know, sleep aids that can be helpful. But if someone's really not rebounding and really having a lot of trouble with sleep, certainly trying cutting it in half or removing it at night can be effective. Mohammed, I have a question. Found some of my patients who quit smoking and found a problem with good sleep. Yeah, exactly. As I was saying before, that irritability that comes up. So falling asleep can be a really big issue. I'm going to talk about this in the next slide. I'm going to talk about what we can do to fall asleep. So I'll start and do that. And Sandrine, perfect. Melatonin is favorable to be taken at dinner time, then at bedtime. Perfect. Love that. Let me go back here. Okay. Alcohol as well. Decrease or avoid alcohol if possible. Alcohol in general. Again, this is where I get too excited and I spend too much time talking about things, but alcohol in general, it's interesting. So many people think like, oh, I'm going to have alcohol. It helps me sleep. They'll, you know, drink before bed because they're like, oh, I need like wine to help me fall asleep. And I'm like, do you wake up around like 3, 4 in the morning? And they're like, yeah, so I really do. And I'm like, that's because alcohol has that rebound effect. So for a lot of people think alcohol, it's a depressant, right? It slows us down. It makes us a little bit sleepy. It makes our head a little bit heavier. But then what tends to happen is what I always say, what goes down must come up. And so, yeah, you're falling asleep. But then what happens is that like 2, 3, 4 in the morning, your body's like, you know, processing, metabolizing all that alcohol, and then you're getting that stimulating effect. So for some people, they can like wake up as well. And so decreasing or avoiding alcohol could be helpful. And I see where people are coming from. If I'm having trouble sleeping and this is now helping me fall asleep, I'm like, well, I'm going to do it. But then you're also not having that, you know, you're waking up at 2, 3, 4 in the morning. So you're actually not getting that good sleep. We also know that alcohol in general can impact someone's sleep architecture. So someone will have issues with, you know, that those sleep stages, getting into deep sleep, getting into that like 3, 4 REM sleep. So alcohol has definitely messes with sleep. And then exercising. And exercising is really interesting because exercising we know can be really, really great for sleep, but it depends on the time. And so exercise can reduce that waking up in the night. It can improve sleep. It can, you know, it's tiring for people. So using, you know, expunging that energy from our body, removing that adrenaline and that cortisol that's flowing through our body is fantastic, right? It's really, really helpful. But you want to make sure that it's moderate activity and that you don't want to be doing it any later than 3 hours before bed. So if it's 3 hours before bed, that sometimes can have a really stimulating effect for people. And you want to keep it pretty moderate. My favorite one is, if possible, walking, you know, preferably outside, but, you know, a light medium walk, you know, 30 to 40 minutes midday, if possible, is generally kind of more favorable. I don't want someone to be doing CrossFit right before bed because that's going to be really impacting their sleep as well. But exercise is fantastic for sleep. So talking about sleep hygiene. So sleep hygiene is what we do to create a really good sleep environment. So we're creating a sleep environment. So it's the environment that we're in and the behaviors that we engage in that help promote sleep. And so sleep hygiene is not an insomnia cure. It's not an insomnia treatment, but we do know that practicing these can improve our sleep quality and duration. And so generally, one of the first things I will do with clients is if someone is having trouble with sleep, or if I'm seeing like anxiety related insomnia, the number one thing I start with is sleep hygiene. So we're going to start working on different sleep hygiene tips, different practices that someone can engage in, different external cues for sleep. I'll do that first before we get into, some of the more CBTI treatments, because that can be there. It's not really fun for people. And so I want to make sure that we're getting good sleep hygiene. Sleep hygiene is also, if someone is going to be doing treatment for sleep, they need to have good sleep practices already. So it's a great foundation and it's a great first start. Leslie, great point. Yeah, darkness cues the pineal gland to secrete melatonin. Absolutely. So different sleep hygiene tips for clients. And I'll always share this with people. I'm like, it's always so interesting because when we were babies, right, we would have these beautiful sleep routines. And I see my friends who are parents now, I see them, they have these like beautiful sleep routines. They have a really set bedtime for their baby. They have, generally like a set wake up time in a way, they get like their nice like bath before bed and lavender and the dark room and, story time and, just like this like nice kind of very relaxed, calming sleep routine for their babies and for their children. And then somewhere along the way, we take control over our bodies and we're eating in bed, we're, doing work and then putting our laptop away and thinking we can go to sleep, or we're going for a run and then we get home and we're, cleaning up and making lunches and then going into bed and being like, how come I can't sleep? Or my favorite, and I do sometimes too, is, we're scroll. I'm watching all like the little fun videos on Instagram and TikTok. And then I put my phone upside down and I'm like, how come I can't fall asleep? Right? There's not really a routine around sleep. And our bodies are routine. Our bodies really, really like to know what's happening. And so our body responds really well to routine and consistency and external cues to help us sleep. And so basic sleep hygiene principles and different things that we need is maintaining rough sleep wake times, like consistent sleep wake times. Going to bed roughly at the same time, waking up roughly at the same time can be really helpful. Again, it cues our body, it creates routine from our body. It creates our circadian rhythm. It sets our internal time clock. So rough sleep wake times can be really effective for us because it tells our body it's time to go to sleep. Our body starts to cue itself to fall asleep. A cold, dark room. And interesting what Leslie was saying, darkness, allows our brain to create melatonin. So a cool, dark room is key. So I like to have people like dim their lights in their home if they can before bed, or just turn on a couple lamps. Don't go into like a super bright bedroom right before bed. Having some like, dimmer lights and then darker lights can be really effective. So and then pure darkness at nighttime is really effective. And then cool. And it's really, really cold. People are always very surprised about how chilly it is, but 16 to 19 degrees Celsius is kind of what the guidelines say. And if you think about it from an ancestral perspective, or, back when we were living in caves, we didn't have clocks, we didn't have time of day, we didn't have any of that. And so generally our cue for sleep was that it was dark. And we would oftentimes sleep in caves, which were cool and dark. And so our body hasn't really moved on from that yet. So our body really likes to and responds to cool, dark room, because it helps our body to, it's a cue to our brain. Okay, it's time for sleep. Let's start that melatonin pumping. Let's start to calm down. Let's tap into that parasympathetic nervous system. And so it is a cue to our body to have that cool, dark room. Another way that can be really effective too is to have like a hot shower or preferably a hot bath before bed, and then go into that darker, cool room, which also can cue to our body, okay, now it's time to sleep, right? It's like that little hit of melatonin telling our body it's time to pump that out. I also really love to recommend, and it's funny, I like to recommend it, but I also sometimes don't follow it, is a digital curfew. So any electronic is emitting blue light. So my laptop, my phone, my TV, any electronic emits blue light. Blue light suppresses melatonin production. So it's about 2 hours. And so what that means is we need melatonin to get into those deeper levels of sleep. So again, those like deeper levels of sleep stages at 3, 4. And so if I'm on my phone, let's say until 10 o'clock, and then let's say I want to go to bed at 10 o'clock. So I'm on my phone till 10 o'clock. I flip over my phone, I go to sleep, and I fall asleep. I fall asleep fine, but I'm still feeling kind of tired. I'm still kind of feeling, you know, like I didn't have a great sleep last night. The reason being is because my body, that suppression of melatonin production means that I'm not able to kind of get into that deeper sleep stage until about midnight, because it's about 2 hours that it prevents it. And so what's happening to me then is I'm thinking I'm sleeping, let's say 8 hours, but I'm really only sleeping 6 hours. So many people are getting in that they sometimes when they have that blue light kind of overdoing that blue light, or they find that they don't have the best sleep, or they wake up a lot in the night, something that I'll look at is that digital curfew. Because if someone's having trouble falling asleep and getting to those deep stages, any little noise, any little like movement, if they have a partner, if they have a pet that's waking them up, they're more likely to wake up in the night as well, because it's easier to wake because they're in those lighter stages as well. Different relaxation techniques. So again, I was saying, when we take over our body, we like generally go, do all these things, and then go into bed and think we're going to fall asleep. What happens is we have our parasympathetic nervous system and our sympathetic nervous system. And if you think about our nervous system, when we're going, doing all these things, and then go to bed and think, okay, it's time to fall asleep, our body hasn't shifted from that sympathetic nervous system, which is our alert and aware nervous system, to our parasympathetic nervous system, which is our rest and digest nervous system. We need to be in parasympathetic response to fall asleep. No one falls asleep. But if you think about it again from an evolutionary perspective, if I was running and then I could fall asleep right away, that would not be conducive to, day to day and, fighting off bears. And so we do need to have that relaxation time. We do need to like down regulate our nervous system. So the dim lights, reading a book instead of reading your phone or watching TV, listening to music, listening to a podcast, all of those things can help like bring us down into our parasympathetic nervous system, which then can be conducive. And I find that too. Sometimes people will come up to me and they'll come and see me and they're like, oh, I have so much trouble sleeping. And I'm like, okay, well, walk me through your evening. Tell me what your evening looks like. And then they're telling me they're like making lunches and working out and, talking on the phone or seeing a client before bed and all of this stuff. And I'm like, well, let's add some relaxation. Let's add a little bit of relaxation time into this, and let's see if that can be helpful. Because if our body is so alert and aware, we need that time to down regulate. We need that time to decompress from our day. So different meditations can be really helpful. Different sleep meditations can be really helpful. Meditation in general, mindfulness before bed is really helpful. Progressive muscle relaxation, which is one of my favorites, And it's actually used as we use it when we treat CBTI. So as part of CBTI, we give everyone a progressive muscle relaxation to do every night before bed. And essentially what it is, there's lots of ones on YouTube. You can find YouTube clips, and there's scripts as well. But essentially what you do while you're lying in bed is you're systematically tensing and then releasing different parts of your body, moving up and then back down. So you would start with your feet. You'd be like squeeze, 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 really tense your feet, squeeze them into little balls for like 5 or 10 seconds, and then release for 5 or 10 seconds. And then you go with your calves, tight, 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 and then release, thighs, all the way up to your face, squeeze your whole body at the end, 5 or 10 seconds, and then work your way back down. Basically, what you're doing is, again, it's a mindfulness technique, which is really, really relaxing. It is allowing our body to go into that parasympathetic response, because what it's doing is it's telling our body there's no threat here. I'm relaxing. We're consciously relaxing each muscle part. And for a lot of people, if you've ever done a body scan before too, there are times when we're tense and we don't know, we didn't even recognize we were tensing those muscles. And so what progressive muscle relaxation does is it allows us to really go in and like almost manually release every part of our muscle. So that can be really relaxing for people. I also there's a really good one on YouTube. It's an ACT meditation. It's called Leaves on a Stream. And it's a way you envision putting each little thought onto a leaf and watching it kind of float down this little pond, this little lake, watching those little worries kind of float away. And that can be a really helpful one before bed. But again, anything that we can do to tap into that parasympathetic response. I didn't put it here, but another one I like, it's a yoga pose. It's called legs up the wall pose. And essentially what you do is the best way I tell people is flip around in your bed and then put your legs up on your headboard or on the wall and hang out there for like 10, 15 minutes. Again, taps us into parasympathetic because it tells our brain, there's no threat here. I don't need to be alert. I don't need to be aware. So it puts us into that restful state. So that can be really helpful for people as well. If that's not accessible for people, as long as your feet are above your heart, you're getting it done. So I'll say, like, put a few pillows on your bed, and at least if it's elevated, you're still getting the response from it. I just want to go back to digital curfew because Leslie said if night shift settings emit blue light. I've never gotten a straight answer. I think it reduces blue light, but it can still be stimulating. There's also those blue light glasses that people can buy. Again, it reduces it. They're not perfect. And I'm always funny with a digital curfew because I'm also a human. And so I recognize that it can, I recognize the impact that it has on sleep, but I also recognize that, again, like I'm generally on my phone before bed as well. And so, I always say like progress, not perfection with this, using the night shift setting, using blue light glasses. If you can listen to something instead of reading, looking at your phone, or even trying for like 30 minutes before bed to try and go, digital free can be helpful. The the guidelines are 2 hours, but again, I'm also a realist and I work with youth. No one's doing that before bed. So, progress, not perfection. So certainly the night shift setting, certainly blue light glasses. Blue light's fine before noon. After noon, so if people do have those blue light glasses, I find don't wear them before noon, but after noon, certainly put them on. If people are going to nap, keeping naps to 20 minutes or less, that's a sleep cycle, so you don't want to be going further into that. Try not to use your bed for anything other than sleep and sex. So we really want to make sure that our bed is sleep time for bed. Our bed is used for sleep. We're not eating in bed. We're not talking on the phone in bed. We're not working in bed. Our brain needs to connect bed with sleep and nothing else. Avoiding heavy meals before bed can also be really helpful. So it's about 3 hours. Some people do respond well to having a small snack before bed, preferably a more carby rich snack because that can help with serotonin. But in general, heavy meals and eating before bed, you want to cut that off for about 3 hours because you don't want your body to be digesting. Again, our body needs to be sleeping, not digesting, and then also trying to sleep. So you won't get as great of a sleep as well. Something that I really love as well is daylight exposure first thing in the morning. So it's very easy now. If I was talking about this in the winter, it'd be very difficult. But it's bright in the morning. So if you can, when you wake up in the morning, go outside if you can, go in your backyard, go on your balcony. At the very least, open your blinds and get some daylight, get some sunshine onto your face. What that does is it resets our circadian rhythm. So it tells our brain, okay, I'm not sleeping anymore. It's time to wake up. And that is also really helpful with that consistent sleep wake times. So again, thinking about the cave, we wake when it's when it's light, we sleep when it's dark. We want our body to reset to that. That's why a lot of people post night shift workers really struggle with sleep because their sleep routine is so out of whack, their circadian rhythm is so out of whack. And so having that kind of to set can be really helpful for people. And then what we do when we get into CBTI is if someone's tossing and turning, if you're tossing and turning for like more than 5-10 minutes, generally what I like to recommend and what we do with CBTI is getting out of bed. Because what tends to happen if you've ever had a sleepless night, and I think if anyone's ever had a sleepless night, you know this, we start to like look at the clock and then it's like, oh, if I fall asleep now, I'll have like 4 hours sleep left. And then we start to like, again, I'm like, I do not do math, but in the night, if I can't sleep, I'm doing like math, trying to figure out, I'm adding, subtracting, figuring out like what math I'm doing. And so again, not conducive to sleep. It's also very stressful. And that's what we can find for many people with insomnia, especially early insomnia. A couple sleepless nights is, common and but when we start to relate sleepless nights with anxiety around falling asleep, so if we're being like, oh, I hope I sleep tonight, I'm not going to have another sleepless night, and then we're in bed and we're having another sleepless night and we're like, oh my gosh, why is this becoming a problem? Am I going to need medication? What's going on? We start to worry about it. That anxiety it prevents us from falling asleep, but it can also become more pervasive and really impact our sleep overall. And so if someone is tossing and turning, I would recommend getting out of bed. Don't do anything stimulating, but like go and sit on the couch, or I would not lie down on the couch, but I would go sit on the couch and like listen to something that's kind of boring, or read a book, or listen to some calming music. And then when you feel sleepy again, go back to bed, because we don't want to equate our bed in our bedroom really with that stress and anxiety and that frustration. So that could be a good one for people, because we really want to be mindful of the impact that it can have. And a lot of these sleep hygiene principles is funny because I think we've all heard many of them before, but when you think about them in kind of from evolutionary in how our infrastructure for sleep works, we want to make sure that we are having those little cues before bed, because our brain responds really well, like I said, to routine and to cues and to little hints. So waking up in the morning and knowing that we're getting that bright light prevents us from lying in bed and scrolling on our phone for a couple hours. Having that cool dark room, or having that bath before bed, or doing a calming sleep meditation, or a progressive muscle relaxation, or a leaves on a stream, or anything like that after a bath, again, cues to our brain, okay, it's sleepy time now, it's time to fall asleep, let's downgrade things. There's less confusion, so our body really likes that routine. And I find that once we start getting into that routine, it really attunes our brain and our body to be able to start to get into that sleep a little bit more, or start to get into that sleep stage a little bit easier. I love to share these kind of fun, different sleep tips that have evidence. So, lavender essential oil actually has some literature behind it as well. And so, some people will have lavender essential oil in their bed, in their bath, or I just like to have people, like I say, like like you can put in your room, but there's like pillow sprays, or put a dab on your hand, rub it together, and then take a couple deep breaths in. But it has shown to be calming and relaxing for people. So I do love them. If you think about the pattern, right, those cues, for many people, the smell of lavender, we've now paired it with it's time to go to sleep. So that can also be another cue to prime our brain and to prime our body to fall asleep. So lavender essential oil is a great one. I didn't put it on here, but chamomile tea and valerian root tea have also been shown to be really helpful. I also have a lot of clients who swear by those like celestial seasonings, the sleepy time tea. A lot of people do really well with those sleepy times tea. And then that's twofold. So tea before bed, again, routine primes our brain and our body. Anything that we're doing all the time, it creates that habit, creates that priming to be able to fall asleep. So that is one. The other one is using those specific teas have been shown to be relaxing, which helps to tap into parasympathetic, which helps follow. So chamomile tea and the time tea are also weighted blankets, and I those are out there. I think we've been seeing quite a bit of them. They are helpful. Some people find them, the eye pillows are fine. People say it can be really heavy, so if you over and then there's like this weight on you. But in time before bed, using a weighted blanket. What it does is it's deep pressure touch stimulation. So what it does is it works on all the pressure points. It's a little bit of weight on all the different pressure points, which again is that cue to our brain. There's no threat here. It's time to fall asleep. So it kind of works similar to that progressive muscle relaxation. It's just calming, brings everything. And so weighted blankets can be helpful. Again, 15 to 20 minutes before bed, lie down, ideally with your whole body covered with a weighted blanket. What it does to your brain helps you tap into that parasympathetic, which helps prime our body to fall asleep. I'm a big fan of magnesium. So magnesium glycinate, it's a supplement that people take. It's We're seeing a lot of literature coming around on magnesium glycinate or magnesium in general. Anyone who's anxious, we're finding that they're kind of more deficient or have lower rates of magnesium in their system. And so magnesium is a great supplement that I really like for mental health, but also for sleep as well. Again, just calming, relaxing, helps our body tap into that parasympathetic, which can help prime us for sleep. So you can take it in supplement form. Magnesium glycinate is the most bioavailable. You can take it in tablets or there's a powder. The powder generally tends to work a little bit faster. So some people do respond better to the powder. You can get flakes that you can put in your bath. Which I really like. Epsom salts, people talk about. Epsom salts are essentially magnesium. And then you can also get it in a spray form. So people use it as a foot spray, so topical. So a couple sprays on feet before bed can also be helpful for people. Anytime I talk about any supplement, I always say check with your pharmacist, check with your doctor, but magnesium can be a really great supplement to add on for sleep with people. Different noises as well. So generally we want to be having a quieter room, but some people, depending on where they live, they don't have that option, or they find that having that little bit of noise can be helpful. So white noise is really well known. Brown noise is shown to be a little bit more effective. Brown noise is just a little bit deeper and a little bit rumblier. And so some people find that they respond really well to brown noise. I just like look it up on YouTube or Spotify, just put like brown noise 8 hours and play it on a little speaker. But that can be helpful for people to drown out noises or also just to kind of give that kind of foundation. And then, like I mentioned before, blue light glasses before noon is fantastic as well. Like I said, progress, not perfection. It's not perfect, but it can help prevent some of that suppression. Lauren, absolutely. I love Insight Timer, love the progressive muscle relaxation. And yes, Yoga Nidra is a fantastic sleep meditation. And it's a great one. I love that one for clients. Amazing. Any questions? Like I said, if I don't get to any questions, I can always share them with Natalie as well. Oh, Leslie, thank you so much. That's so sweet. Thank you. And I'll definitely share some information on sleep cessation and nightmares for you as well. Because I know for Marie Helen, I'll definitely share that because yeah, I didn't talk about, there's so much that we can talk about, but I didn't talk about that one. Thank you, everyone. Amazing. Thank you. And then I'm also going to share with everyone, and Natalie's going to share it out. I'm the co-founder of Home. So Home is we were a studio, but now we're an app. So we're a VR app, a virtual reality app on the Meta Quest, but we also are on the Apple Vision Pro. And now we just launched a mobile app for why can't I speak, for your iPhone, for the App Store and for Google Play. So if anyone wants, you can use a free month. So there's a code free month. Natalie will send it out as well. Just download from the App Store, Home Meditation and Sleep. There's Yoga Nidras. There's progressive muscle relaxation. You might hear a familiar voice because I do the progressive muscle relaxation. But you can try it out and, see if you like it. Just make sure with the code to cancel it before the month is over if you don't want to get charged. Awesome. Thank you all so much for spending your lunch hour with me.
Awesome. Well, thank you so much, Stephanie. That was a great presentation with lots of amazing information and also just a lot of good reminders for us personally or for our clients. So yeah, that was wonderful. Thank you.
Thank you so much, everyone.
Yeah. So just before we head out, just a couple reminders for everyone that we'll be sending out the link to the evaluation and post-learning assessment by tomorrow for those who registered and are interested in receiving a letter of completion. You have to complete that by next Wednesday. As well, just want to take the time to let everyone know about our next upcoming webinar on engagement strategies for youth and vaping on July 24th. So look out for registration coming soon for that. Another exciting topic. So yeah, and then if anyone wants to miss today's portion of today's webinar, wants to view it again or share it with any colleagues, an archive list can be found on our website as per usual. But for now, thank you all so much for joining and participating today. We hope everyone has a great rest of their day. Thanks, everyone. Thanks,
Thank you,
Stephanie.
everyone. And I hope you have a good sleep tonight.
Yes, you too. Bye.
Bye, everyone.